Good evening, everyone. Myself, ARSHDEEP Singh, Assistant Professor, Meera Medical Institute of Nursing and Hospital, Abohar. So today I am going to explain you about the topic that will be chickenpox. So before starting that topic, uh, I will suggest you to subscribe to my channel that is on my name, that is ARSHDEEP Singh. And one more request that you must also subscribe to our college official YouTube channel, that is Meera Nursing College. And one more thing, that recently our college official YouTube page has crossed 1 lakh views. So it's getting popular. So students are getting benefit from the various nursing lectures on the different subjects. So I suggest you to please subscribe to the channel, and also I suggest you to click on the all notifications button, so that whenever we are going to upload a video, you will get the notification of each and every video. Okay, so let's start with the topic, that is chickenpox. So chickenpox is the disease. First of all, is the introduction. So this is the disease uh, that I want to say that most of us have also already affected with this disease when we were in our childhood. So this is a very common issue in case of the children's. So I think 7 to 8 children, in case of the children, they are affected from this type of infection. Okay, so it is a very common infection of the childhood. So let's start with it. So first of all is the definition. What is the definition of chickenpox? So the other name for the chickenpox is varicella. So that is the based on the name of its causative organism, that is varicella zoster. So chickenpox or varicella is an acute, highly contagious viral disease caused by varicella zoster. And VZ virus, it is also known as VZ virus, characterized by fever, vascular rash, and malaise. Malaise, that means that body feels tired, or that is the meaning of the malaise. And vascular rash, the different types of the rashes. Most of the body is covered by the rashes and lesions, and after that, there is a stage that will lead to the formation of the scars. Okay, so it occurs worldwide in endemic and epidemic form. So that was all about the definition. So chickenpox is a acute disease, but is highly contagious. For example, contagious means to say that when we touch a person who is infected from the same infection of the disease, and we are touching the specific person, we can also get that specific disease. So that type of category of disease transmission is regarded as contagious disease. Next is the epidemiological determinants or the factors that results in the infection, or in that may make a person on the risk of that he or she might be getting infected with this type of infection. Okay, so first of all is the agent factors. So I will divide the epidemiological determinants into 3 factors. First of all will be the agent factors. Second one will be the host factors, and third one will be the environmental factors. Okay, so first of all is the agent factors. So first of all is agent. So obviously the agent would be the varicella zoster virus, that is also known as VZ, and it is also called the human herpes virus 3. So that is the question that might be asked in the Viva questions on the BSc 4th year community, or GNM 3rd year, or either BSc 2nd year, or the post basic 2nd year. Okay, so the second name or the other name for this virus is human herpes virus 3. Okay, and recovery from primary infection causes latent infection in dorsal root ganglia, and later, due to diminished immunity with age or after immunosuppressive therapy, the virus may cause herpes zoster. So that is the agent, and that is the thing how it affects the body. Okay, next, second one is the reservoir. So reservoir, what would be the who will be the reservoir for chickenpox? It is a case of the person who is already affected from the chickenpox. So that acts as a reservoir for the chickenpox. Next is source of infection. What are the various sources? It is respiratory secretions. So that are the main causes, or the source of infection for this. So respiratory secretions, Then is the lesions of the skin. So different types of lesions that are appearing on the skin that may harbor this type of disease, and mucosa of the patient and vesicular fluid during the first 3 days of illness. These are the sources of the transmission or the infection. Okay. Next is the infectivity. 1 to 2 days before the appearance of the rash, 4 to 5 days thereafter. So that is the period of infectivity. That before the appearance of the rashes, that will include the duration of 1 to 2 days, and after the appearance, that will include the 4 to 5 days duration. Next is secondary attack rate. In household context, secondary attack rate is 90%. For example, if a specific person in the family is affected with chickenpox, then there are the chances, more number of chances of this disease getting spread to the another person of the family, because most of the situations that specific person is not isolated from the infected person. So the secondary attack rate would be very high, that is 90%. Okay, so next is the host factor. So it is usually seen that if one person of the family is having chickenpox, the other might get uh, infection from that specific person in a sequential manner. Okay, so to stop this or prevent this, we have to follow various type of precaution that the specific person who is infected from this infection must be isolated in a separate room. His clothes, his utensils in which he or she will take the food or any of the substances uh, coming in contact with that specific person must be isolated from the members of the other family, so that this is the way how we can prevent this the transmission of infection from one person to another. So that is I was telling you about the how the secondary attack rate is more in case of chickenpox. Next is host factors. So these were the agent factors. Next is the host factors. First includes the age. Children under the age of 10 are primarily affected. As I have already told you that it is the disease or infection of the childhood. So it is affecting the children that are having the age group that is below 10 years. Adults can also be affected, but their chances are less, but they are getting infected. Next is immunity. An attack of chickenpox gives lifelong immunity, and during the first few months, infants are protected by maternal antibodies. Okay, so this is a disease that you will only get once a time, and after that, you will be having a lifelong immunity to this disease. Third is the pregnancy. Infection occurring during pregnancy carries a risk for the fetus and neonate. So it is obvious that any type of infection, not just the chickenpox, any type of infection might be harmful for the you can say that the fetus. There can be the complication or the like the congenital malformations can be there if the chickenpox occur during the pregnancy. So the pregnant woman must be prevented from this infection. Next is the environmental factors. So there is a seasonal trend that is it occurs mostly during the 6 months of the year. Okay, so there is a seasonal trend mostly. Uh, we can say that the 6 months are very crucial for this type of interaction, and overcrowding favors this transmission. If more number of persons are living together, for example, in a congested area, they might be getting the risk. There is a more risk of getting infection of that type of infection or disease. Next is what is the mode of transmission. So chickenpox is spread by direct face-to-face contact. So we can understand from this that it is a direct contact of transmission, direct contact transmission. We can categorize it in that specific category from person to person by the inhalation of the droplets and droplet nuclei or through respiratory tract. Mostly it is spread out through the respiratory tract. Contagious disease by contact with another person, that is from skin to skin, might uh, we can say that is can infect another person. Okay. Next is the incubation period. So usually it is 14 to 16 days. That is a very important question for the Viva, and whenever it is asked, you must answer this like the incubation period of chickenpox is 14 to 16 days. Okay, but usually it may also be 2 to 10 to 21 days. But the exact answer is 14 to 16 days. Okay. Next is what are the clinical features? What are the clinical features? So that was about the environmental factors, host factors, or the agent factor. That means a whole about the epidemiological factors, because in epidemiology we Epidemiological triad of dynamics is consist of the three things, that is agent, host, and environment. Next is clinical features. So clinical features of this disease or infection is categorized under some of the stages. Like first is the clinical course of chickenpox may vary from mild illness to severe illness with fever and widespread rashes. So that is the basic, we can say that the clinical feature by which we can easily assess that these are the symptoms of the chickenpox without any type of we can say that the diagnosis. But for the confirmatory test, we have to do the following things. Okay, or the confirmatory clinical signs and symptoms are as follows. First is the pre-eruptive stage, in which there are no lesions, no eruption of the lesions. Okay, so what it will include is firstly sudden onset with mild or moderate fever, and second is backache. Backache means to say back pain. And then third is the shivering and malaise. So these are the pre-eruptive stage symptoms of the clinical features that would we can say that the symptoms that are the common symptoms in this or the first stage symptoms in this type of infection, and this stage lasts only usually for the 24 hours. Okay, next is the eruptive stage. This is there is the appearance of the rash the same day as the fever starts, particularly in children. The rash shows the following features. Okay, so that is the second stage. In this, there is the appearance of the rashes. Okay, and this we can say the distribution of rashes show a stage of the pleomorphism. So that will include here in later stage. So what is distribution of rash? First point is rash is symmetrical, first appearing on the trunk abundantly and then on the face and the legs. So that is the sequence how the rashes appear on the body in case of chickenpox. Okay, second, there are the lesions in the buccal and pharyngeal mucosa, and next axilla may be affected. This is the trend in case of chickenpox, that how the rashes appear on the body and how in a sequential or the chain manner it's getting affected to the other parts of the body. It's affecting the other parts of the body. Then axilla may be affected, and at last palms and soles are usually not affected. Okay, so we can say that only these appear on the skin, except, or we can say that the usually palms and soles are free from the any type of lesion, formation of lesion or scar. Next are the rapid evolutions. This was about the distribution of rash. Next is the rapid evolution. So what includes in this is first the rash changes quickly from macule, papule, vesicle to scab. So this is the form of sequence that firstly the rash changes to the macule form, then papule form, then vesicle to the scab. So in this, firstly, scar appears, then after some duration or some time, there is a water-filled cavity. We can say that that leads to the macule, papule, vesicle, or the scab stage. Okay, so there is increase in the size of the scab formation. Next is the vesicles rupture easily. Sorry, the vesicles are filled with clear fluid and are superficial. So as I have already said you that, so after the formation of scar, then there is a formation of the vesicle, that means to macule, papule, vesicle or scab. Then it is filled with a clear fluid. Okay. So next are the vesicles rupture easily, and when these vesicles ruptures, the fluid contained in that as it's pressed to the other organs, or it is touching the other organs, the vesicles or the scabs are appearing on other parts of the body also. Okay. Next, they are not umbilicated. The vesicle forms crusts, and scabbing begins 4 to 7 days after the appearance of rash. So usually there is a duration of 7 to 8 or to 10 days totally of the chickenpox infection in which these all the stages occur. Okay. Next is the name, that is pleomorphism. That exactly is the point that what I was discussing about. All the stages of the rash that includes the papules, vesicles, and crust may be seen simultaneously, which is classic feature of rash in chickenpox, because the rash appears in crops one after the other for 4 to 5 days. So there is appearance of the rashes, and there is change in the form of the rashes. Firstly, the rash changes to the macule, then to papule, then to the vesicle, and then to the scab. Okay, so vesicle is the stage in which there is a water formation in that type of papule. Okay, next last is the fever. So that is the fourth category. or of the clinical, we can say that the clinical symptoms in this fever is not high, but occurs with each fresh crop of rash. Okay, so that was all about the clinical features of this infection. Next is the complication. So what are the various complications that we can see in case of chickenpox? So firstly, there are different types of complications. Like first of all is the hemorrhages. It may be the some of the sites that may be bleeding. Second is the pneumonia. Third is the encephalitis. That's the inflammation of the brain. That is the common. We can say that uh, that is one of the complication of the in case of chickenpox. Next is acute cerebral ataxia. That is lack of muscle control. That is also we can see in many of the stages, many of the cases of the persons who are getting infected from chickenpox. Next is Ray's syndrome. That is acute encephalopathy associated with fatty degeneration of uh, viscera of particularly the liver. So that means that chickenpox usually affect the organ, that is a major organ, that is liver in common. One can say that. Last, maternal varicella during pregnancy may cause abortions and birth defects, congenital defects, low birth weight baby, and intrauterine infection. So these are the things that I was discussing about, that if a pregnant woman is infected uh, from chickenpox, so these are the results like the birth defects, congenital malformations, low birth weight baby, and intrauterine death or infection can also be there. Next is the laboratory diagnosis. So first of all, I would say that chickenpox does not require any type of diagnosis because it is obviously clear on the skin that there is a formation scar. But for the confirmatory tests or any other thing, really required because the clinical signs are clear cut, as I already discussed. Examination of the vesical fluid under the electron microscope shows round particles, brick shaped in smallpox. So these will show the type of the virus, and that can be the confirmatory test. Okay. Okay. So I got some of the views in Punjabi. That is बहुत बढ़िया from Gagan Kang. Thank you very much. And Rajveer Kaur, good evening. Good evening, everyone. Thanks for your wonderful messages. Thank you, everyone. Next is prevention. Okay. Yeah. Next is the prevention. So how we can prevent the chickenpox infection. So first of all, it includes the varicella zoster immunoglobulin, that is VZIG vaccination. It affords passive immunity. It provides passive immunity, and it is given within 72 hours of exposure in the dose of 12.5 units per kilogram body weight up to a maximum of 625 units. So that is the dosage of this type of immunoglobulin that is administered in the body of the person who is affected from specific infection. Okay, and repeat dose is given in 3 weeks IM to modify to prevent the disease. So that is how we can prevent this infection. Next is vaccine. Active immunization with the live and attenuated varicella virus vaccine is safe and is given to children 12 to 18 hours of age who have not who doesn't have the chicken pox. So that is the vaccination for the prevention, like the persons who are not infected from the disease till now. So it affords 90% of the protection in an outbreak if given 3 to 5 days after exposure. Okay, so that is a term of the dose that is given during the for the prevention of chicken pox in the various situations. Next, last in this today's topic is what are the control measures and the nursing care involved. That is the main point. How we can control or manage the situation of the, I can say that the various types of complications or the clinical stages that may occur during the infection. So, and what is the nursing care involved? First of all, is the infected person should be isolated from school or daycare center for 6 days after appearance of the first vesicles. So it is obvious that prevent other from getting infected. So we have to isolate that specific person, either child or adult, from other persons of the family members or the school or the I can say that college or any other institution in which there is a mob. So he or she must be isolated from others. Next is Patient is given symptomatic treatment that's antipyretic because fever may be present and analgesic to relieve the pains of the scar or the vesicles. Next, cover mouth when coughing and sneezing. So if he or she can use the mask, that would be very good. Tissue should be disposed of by burning, and handkerchief should be washed with soap and water and then boiled for 30 minutes. So that is a maintenance. Next is bed linen and patient clothes should be washed in hot and soapy water and dried in the sun. So this is how we can wash the clothes of the specific patient so that the other person might not be getting infection. Next, avoid exposure of the pregnant woman, newborn, elderly, and unimmunized person to the patient. So these persons should be isolated specifically from that specific patient. Next is hand must be washed thoroughly after contact with the patient. Blisters filled with fluid and oral nasal secretions. Povidone iodine can be used for hand washing, and it is a very good disinfectant. And as it is a good bactericide and useful antiseptic with sporocidal action. So that is povidone iodine. It's also used in the betadine solution. So and other type of disinfectant. So that is a very helpful. We consider the bactericide. So that can also be used for the in case of hand washing. Next, cases should be reported to the local health authority like the district medical officer and malaria officer, so as to assess that is there any situation of being epidemic, that to count for the or assess for the total number of the cases in that specific area, and for them from that we can assess the stage of the epidemic. Okay. Next, avoid contact with the client's nasal secretions and fluid from the vesicles. So that is the main point, that we should be isolated, or we should not get in contact with the any type of respiratory secretions of the patients. And last one is the concurrent disinfections of the secretions from nose and throat and of the article soiled with such secretions. Cresol 5%, that is also one of the disinfectant solution can be used for disinfecting the soiled articles. So these must be used. Okay, clear? So this is how we can control various matches, and that is the good nursing care that is to be provided. Okay, so that was all about the today's topic. It was a short and sweet topic. So that is, I have chosen this topic because it is very common infection or disease. Most of us have uh, this infection while we were in our childhood. Okay, so you should also give this health education to your family members or other relatives of the friends, so that they might prevent themselves from getting infected from this type of infection. Okay, so that was all about the topic. Thank you everyone, and in the next week I will explain you about a new disease. So get in touch with uh, these videos. So subscribe to my individual channel or also to our college or the institute's official YouTube channel, that's Meera Nursing College. So thank you everyone. We'll meet in the next week, and thank you for all the viewers who are messaging me or commenting on this video. So thank you everyone. Thank you very much.